My name is Bhakthi Sahgal, and I'm one of the co-founders of Oncovana. Oncovana is a digital platform and health tech company that is dedicated to helping newly diagnosed cancer patients who are hoping to one day have a family. Every year, nearly 2 million Americans are diagnosed with cancer and early onset cancer. Of those, about 20%, or 400,000 people, are of reproductive age. And while clinical guidelines state that every person diagnosed with cancer should have access to fertility counseling and fertility preservation options, nearly 50% of the time, that doesn't actually happen. Furthermore, for minority patients, that number drops down to 5%. Oncovana is trying to be a leader in this space by ensuring that every cancer patient has this opportunity and is able to make a reproductive health decision that feels right for them. We like to take an empathetic view and put ourselves in the shoes of somebody who gets a phone call saying that they've been diagnosed with cancer. That's often such a stressful time already. And when we speak to oncologists and care team members at cancer centers all around the country, what they've shared with us is that there's so much to talk about your treatment plan, about your priorities, that sometimes the fertility preservation conversation falls through the cracks. Currently, there is a lack of connective tissue between cancer centers and fertility clinics. Sometimes health systems operate like informational islands, and it's hard to get your records from one place to the other. With the way that our health system works, it led us to believe that a digital solution would be the right kind of solution for this problem. The reality is that the fertility journey for a lot of people is a very lonely one, and it has a lot of logistical challenges. Navigators really come in as that critical nexus of support for the patient. They provide all those pieces of care and provide personalized guidance along the way. The third component of our solution is AI-enabled personalized digital education and resources. We want to make it easier for cancer patients to find the information they need, to feel like they understand the processes and what's going to be happening in their bodies. If you have, for example, stage 3 breast cancer, we'd love to be able to give you resources and materials that are specific to that cancer diagnosis and some of your own personal health characteristics, such that what you're reading is really meant for you. We believe that fertility health is critical for everybody, but I would be remiss to mention the particular impact that this topic has on women and the way that they access their healthcare. We've spoken to so many folks in the field that have shared with us just the lack of understanding and lack of resources that often exist out there for women to truly understand the effects of therapies and treatments on their reproductive health. One thing that has been a trend and struggle in women's health research and in scientific research writ large is that a lot of the data that's collected, folks have had to do a lot of work and advocacy in the last many decades to ensure that women are included in the demographics and the sample sizes of that data. This is just another example where we're trying to do our part to really elevate and make sure that what we're designing is something that people feel is usable, in particular for our female patients. Team Oncovana's experience at Halcyon here in Washington, D.C. has been incredible and magical. We find ourselves surrounded by a wonderful and helpful staff, in addition to the community of advisors, mentors, investors, and other folks in the local ecosystem here in Washington, D.C. that are just so passionate about helping us dig into the large questions we have to help for us refine our work. I mean, we could not be more lucky to be in this community, and it has really energized us. We're really excited about the future of the digital health space, particularly as it relates to the data we need to build out these incredible products. We're working with these humongous data sets that are publicly collected or of health systems, and we're really thrilled about the power of AI and additional computing technologies to help us harness those to develop products and consumer experiences for patients and providers that are really meaningful and impactful and make their lives just a little bit easier every day. In the fertility space in general and in the cancer space, a lot of the patients that we speak to want to know that their providers have the time, energy, and effort for them, to engage with them, to look them in the eye. And anything that we can do to ensure that a provider doesn't feel burdened by the amount of administrative work that they have to do, and can actually spend that time one-on-one with the patient, fully focused on them, would go a long way. We're very excited about the muscle that technology has afforded us to be able to be creative and to create something really special for patients.